Hi, I'm Dr. Charles Denham. I'm chairman of TMIT Global and a co-founder of the MedTech Bystander Rescue Care Program. This video is our year-end report and provides the highlights of our 2021 plan.
It's a good news, bad news story. The good news is of our progress. The bad news is of the exploding numbers of infections and deaths. We have to thank our now more than 80 subject matter experts and community representatives on our rapid response team, and the world-class experts who contributed to our 2 Discovery Channel films and leadership training programs whose messages have had great impact. We convened this rapid response team when the coronavirus struck in New York this spring. We originally sought to meet a vital need, helping the essential critical infrastructure workers in 16 industry sectors designated by Homeland Security. Those who care for us, keep us safe, and keep the food, water, and power flowing to our homes. Those who have to go to work no matter what. They were the most vulnerable, and there were no safety training resources for them and their families. Our original belief was that family transmission chains were our Achilles heel. This is now supported by the evidence. However, our big surprise was that our program for essential worker families hit a nerve with the general public, who sought to be trained with them. This dramatically expanded our reach. By year-end, we had established a national community of practice, launched a multi-institutional study at major medical centers, hosted 18 live 90-minute broadcasts and converted them to on-demand recordings, produced 6 Survive and Thrive training programs for families, published multiple articles, provided free continuing education hours for our healthcare professionals, produced short video summaries for mobile devices, and developed rapid response programs to prevent spread during family holiday gatherings. Our leaders made terrific contributions to the program while they've been on the front line caring for patients in the ICUs, like Dr. Greg Boats at MD Anderson. Emergency medicine leaders including Dr. Casey Clements at the Mayo Clinic, Dr. Toph Peabody at UCSF, and Dr. Chris Fox at UCI. Infection preventionists and nursing leaders like Heather Foster and Professor Mary Foley were educating families and nurses. Our law enforcement and first responder leaders include Chief Bill Adcox and Matt Horace, Chief Security Officers from MD Anderson and Mayo Clinic respectively, and Randall Steiner, the Director of Emergency Preparedness at the University of California at Irvine. Even our student leaders, like pre-med student at EMT Paul Bataya, are leading construction of field hospitals in California to meet the surge, and Jamie Irastorza, who is co-authoring medical articles and helping develop CME programs with us. And we have NYU film students Danny Policiccio and Claire Peck helping craft messages and producing media to reach critical age groups, contributing to family spread. So our progress is the good news. I wish we could say we're turning the corner. However, we're not. The bad news is really bad news. As I speak these words, we have 2 new infections every single second and 2 preventable deaths every single minute in America. The growth is absolutely explosive. The doubling time is measured in days. But these are just numbers, and we've become numb to the numbers, but they don't explain the absolute cruelty of this disease. Most of us, especially doctors and scientists, deplore exaggeration for effect. However, the final moments of our loved ones will have them starving for air with strangers they can't see and never be able to say goodbye or get a chance for us to tell them we love them. As a retired cancer doctor, I face the death of my dear patients every single day. But this is totally different. The worst news is that an even greater surge is coming in the first quarter of 2021. Vaccines will take many months to have real impact. It will be too late for many of our families. So what is our 2021 game plan? The good news, and even the great news, is that the very families that are our weakest link can become our greatest strength. Now that we know that family infection transmission chains are our Achilles heel, we can break them by direct actions at the source, at the family behavior level. This can turn the tide in a matter of weeks. It can be done. The CDC, state, and county public health guidelines change almost on a daily basis with the science. That's why every family needs an evolving family safety plan to convert the science to safety. The CDC tells the public the what to do, but not the how. We give them the how and the actions they can take to keep their families safe. We will continue to engage leading medical centers through their experts in a continuous improvement project to study worker-family vulnerabilities to drive our rapid cycle innovation team. By the first week in 2021, we had more than 700 family responses in the study. We will continue to apply our predictive analytics innovation development methods and care path mapping program to address the most important COVID family impact scenarios. This allows us to generate impact calculators that show us where to have the most impact by direct action. Since our series of Survive and Thrive guides hit a nerve with the general public, and our studies showed they wanted to be trained with essential worker families, we'll continuously update them and expand our reach across community sectors in 2021. All families need to keep up on the evolving science of the virus, the reasons for social distance, hand hygiene, the risk of high contact surfaces, the use of masks, avoiding crowded and indoor spaces, mixing household bubble groups, and testing for isolation and quarantine purposes. Most importantly, they need to know how to prepare to care for someone in their homes and when to seek emergency care. Our emergency and critical care physicians and nurse preventionists will continue to tackle coming home safe. How to keep from bringing the virus home to the family by defining best practices at work, the hot zone, where and how to disinfect in the warm zone, and how to maintain the safe zone virus-free where we may even have to care for a loved one. Our Keeping Our Kids Safe program doesn't tell families whether or not to send their kids to school or college. We give them the tools they need to assess threats, vulnerabilities, and risks so they can make that decision on their own, especially in light of the surge in the first 2 quarters of 2021. Our community pediatricians and emergency medicine physicians will continue to weigh in. Our team of youth, college students, and young adults will address their risk as super spreaders and the leadership opportunities within their age groups. The Family Safety Plan takes a deep dive into a step-by-step way of addressing readiness for surges, response when a loved one is infected or exposed, when to rescue a loved one if they have severe symptoms and need emergency care, recovery to a new normal, and resilience, how to make the family and friends less vulnerable. Many hospitals will move to crisis care guidelines when overwhelmed and have to shift care back to families because they just can't take the new patients. Our Family Safety Plans Templates for Everyone Survive and Thrive Guide provides a comprehensive review of plan checklists and templates we created for families and living units such as college roommates. Providing care at home is going to be a real shock for families. In this Survive and Thrive guide, we provided a detailed review of the skills, space, and supplies families and roommates need to have to care for someone who's infected and symptomatic in the home. The goal is to optimize such care while at the same time protecting the family and roommates from being infected. Our infection prevention nurses, emergency medicine, and critical care doctors converted the guidelines for creating an isolation room in a hospital to family guidelines to convert a room in the home to care for someone who is sick. Creating your 2021 Family Safety Plan program provides answers to critical questions about how vaccines work, what to do after vaccination, what to do to get back to a safe new normal, how to balance the other public health behaviors, and what to do about children. Our Family Lifeguard program and Holiday Huddle Checklist was a rapid response solution to the family-generated surge events of holiday gatherings. Successfully deployed to tens of thousands over the 2020 holidays, it will be configured to become a year-round program to keep family gatherings safer. Throughout 2021, our award-winning educators will continue to teach their colleagues and families how to engage children to have an active role in family safety plans. We will continue to use well-known motion picture fictional stories and real-life true stories of innovation, courage, commitment, and accomplishment to inspire families. We will also continue to engage community membership groups such as scouts, teams, and faith-based organizations with customized programs. We will provide them practical examples of solutions to keep their families safe and really live mottos like be prepared. In August of 2020, Homeland Security declared educators at all levels and their service providers to be essential critical infrastructure workers. So in 2021, we will seek to establish at least one showcase example center of excellence in each of these 17 industry sectors, including education. Using the All Teach, All Learn method of the Institute for Healthcare Improvement, We hope to accelerate the impact of best practices to deal with the coronavirus crisis through these centers. Our coronavirus care community of practice is a rapid response development on the existing platform of our MedTech Bystander Rescue Care program. We started it 5 years ago at medical centers, schools, and communities. MedTech fuses the best medical emergency practice with tactical action, which we developed as a rapid response system for active shooter and terrorism events at the world's largest medical center. We discovered that Good Samaritan care can beat failure to rescue for the 8 most common emergencies. Bystanders can triple the survival rate in emergencies before EMS arrives by some very simple training. CPR and AED use for sudden cardiac arrest, the Heimlich maneuver for choking and the rescue of drowning victims, Narcan for opioid overdoses, use of EpiPens for life-threatening allergies, bleeding control during active shooter events, and prevention and care of infections, prevention of drive-over accidents, and prevention of bullying. Simple skills that can be learned in just a matter of a few hours. MedTech is the only program in the world that trains all of these Good Samaritan rescue skills at one time. It began saving lives in the first 7 weeks before our very first graduation of children. We now train anyone from 8 to 80, professionals and the public alike. When the coronavirus crisis hit, we were expanding to communities in 5 states. The coronavirus crisis has driven us to innovate through 2021. We're making all of our MedTech training COVID-19 safe. We're converting all on-site training to full online certifications. We're developing special certifications by sector, and we will be able to train anyone in the world remotely by Zoom or internet meetings. So in summary, we're gratified by our progress. However, we're sobered by the incredible challenge. We pray that we can do everything possible to pursue our mission to take our solutions to scale. The care of our communities is absolutely critical. Thank you for all you're doing to protect those at risk and those who are most vulnerable. As we say to all of our MedTech rescue teams, we have to fight the good fight, finish the race, and keep the faith. Everyone is a patient, and everyone can be a caregiver.